Do you think you know everything about your diabetes? What if you're missing the most important thing? Right now, processes are happening in your body that you may not even be aware of. Every day with elevated blood sugar is not just a number on a glucose meter. You have diabetes. But do you really understand what is happening inside your body? When blood sugar rises above normal, it slowly affects small blood vessels in the eyes, kidneys, and nerve endings. This process is gradual, invisible, but constant. The most insidious thing about diabetes? It works quietly. A sugar level of 8 or 10 millimoles per liter does not cause sharp pain. You feel normal and continue living your usual life. It seems like everything is under control, but in reality, every such day matters. I don't want to scare you, but it's important to understand. Diabetes is not just slightly elevated sugar. It is a systemic disease that affects the entire body. And the earlier you realize this, the more opportunities you have to control it. The good news? You can change a lot. Proper monitoring, timely actions, and understanding the processes can significantly slow down, and sometimes even stop, the development of complications. Yellow circle important check. Do you remember your latest results? Fasting blood sugar, HbA1c, glycated hemoglobin, blood pressure? If not, it's time to refresh this knowledge. Action today. Find your latest test results or schedule new ones. Knowing your numbers is the first step toward real control. When low blood sugar strikes, the scariest moment is when you suddenly feel unwell. Your hands tremble, lips go numb, your head feels foggy. Your heart beats faster, weakness spreads through your body. It's especially frightening if this happens around your grandchildren, in a store, or at a clinic. Because of this fear, many people start overprotecting themselves, eating sweets just in case. Then sugar spikes sharply, causing even more fear. It feels like you're caught between two fires. You're afraid of low sugar and afraid of high sugar at the same time. Low blood sugar is a manageable condition. This is not about heroism. It's about a calm, simple algorithm. 3 steps. Measure your blood sugar with a glucometer. Confirm that it's truly low and not just fatigue or hunger. Take fast-acting carbohydrates, something that absorbs quickly. Wait 15 minutes in a calm state and measure again. Repeat if necessary. When loved ones are nearby, explain these 3 steps in advance. Let them know the plan and understand that panic is unnecessary. Breathe evenly. Sit down. Do not lie on your back to avoid accidental choking. If possible, write down the time and what you ate in your diary. This will help you later understand how much is enough for you. Calmness is the most important part. The algorithm works only when you don't rush or add unnecessary foods. Why low sugar happens? Low blood sugar often occurs due to skipping meals, unusually long walks, unfamiliar physical activity, delayed medication intake, alcohol on an empty stomach. Understanding the cause helps prevent recurrence. If you notice episodes happening around the same time, keep fast carbs nearby and plan a snack in advance. Do not try to fight symptoms with chocolate or sandwiches. After 30 to 40 minutes, sugar will spike sharply. We need precise, small portions. The 15 by 15 rule. 15 grams of fast carbohydrates, wait 15 minutes, recheck sugar. Examples of fast carbohydrates. 3 glucose tablets from a pharmacy. Half a cup of regular juice. For sugar cubes, 1 teaspoon of honey. Chocolate, cookies, nuts, and sandwiches are not suitable. They absorb too slowly. Write this rule on a card and keep it next to your glucometer. Take a photo of the card and set it as your phone wallpaper. Store an emergency supply in 3 places. By your bed, in your bag, in your car. Add a small bottle of water. Action today. Buy glucose tablets, place them in your stash spots, and hang the rule on the refrigerator. Diabetes is not a sentence. Diabetes is a manageable disease, but only if it is noticed early and treated properly. The most amazing thing? Simple knowledge can save lives. Not complex medical terms, but understanding what's happening in your body and how to influence it. Today, we gain that knowledge. Type 2 diabetes, more than high sugar. Type 2 diabetes affects the entire body over time. The heart and blood vessels, fat metabolism, and body weight. In many patients, complications eventually take center stage, from weight issues to cardiovascular risks. That's why modern therapy increasingly focuses on medications with complex effects. Semaglutide, a GLP-1 receptor agonist, helps the body in several ways. Improves pancreatic function, lowers blood sugar, reduces bad cholesterol, decreases strain on the heart, reduces appetite, making weight control easier. In Russia, there are only a few medications based on semaglutide. One of them is Semaglin. Its convenience lies in once-weekly injections, with everything needed for the course included. This is comprehensive support for those who want to control their health, prevent disease progression, stabilize weight, protect the heart and blood vessels, turning numbers into clues. You measure sugar several times a day, but still don't know what to do with the numbers. Yesterday, it was 8, today 12, and you ate almost the same. This creates chaos and helplessness. We don't need all measurements. We need key points. Think of daily weather. Morning, fasting, starting point. 2 hours after the largest meal, food response. Before dinner, daytime background. Before bed, evening outcome. For anchor points, give a clear picture. Keep a simple notebook with 5 columns. Time, sugar, food, physical activity, how you feel. Review it calmly once a week. Over time, you'll see your personal patterns and feel less anxious. Proper measurement matters. Wash hands with warm water and soap before testing. Dry thoroughly. Fruit residue or cream can falsely raise readings. Do not squeeze too hard. It dilutes the blood drop. Follow your glucometer's instructions regarding first or second drop usage. Replace lancets and check strips expiration dates. Low battery or expired strips can cause unstable readings. Dinner order matters. It's not only what you eat, but how you eat it. Plate structure. 1/2 vegetables, 1/4 protein, 1/4 carbohydrates. Order matters. Vegetables, protein, carbohydrates. This slows glucose absorption and stabilizes readings. Try this for 5 evenings in a row. Eat slowly. Put the fork down. Drink water. Listen to satiety signals. High sugar, when to act. A reading of 16 or 20 can be frightening. High numbers alone aren't always an emergency. Danger lies in the combination of high sugar and poor well-being. Red flags: intense thirst, dry mouth, nausea, severe weakness, abdominal pain, acetone breath, confusion. Steps: sit down, drink water in small sips. Recheck in 30 to 60 minutes. Seek help if symptoms worsen. Movement without strain. No gym required. Goal: 150 minutes per week in small portions. 10 minutes walking after meals. Stairs instead of elevator. Gentle chair exercises. Regular movement helps muscles absorb excess sugar. Foot care is essential. Inspect daily. Wash and dry thoroughly. Moisturize. Wear comfortable footwear. Any wound, see a doctor early. Safety on the road. Preparation removes most anxiety. Always carry glucometer, strips, glucose tablets, or juice. Water. 15 by 15 card. Check sugar before leaving. Avoid extreme temperatures for devices. The daily minimum system. 6 simple steps. Fasting sugar check. Medications as prescribed. Proper food order at dinner. 10 minutes movement after meals. 1 post-meal measurement. 1 diary note. That's enough to stay on track. Sleep and stress matter. 7 to 8 hours of sleep improves insulin sensitivity. Reduce screens before bed. Create a calming evening ritual. Stress raises sugar. Daily relaxation is essential. Breathing, walking, calm hobbies. 4-week plan. Week 1, safety. Week 2, patterns. Week 3, doctor visit. Week 4, exams and habits. Track progress, store test results, and celebrate small wins. You've done a big job. Now, step by step, calmly, predictably, according to plan,